Hello. If you're an American citizen, then most likely this is not the first discussion you've heard about the topic of the legalization of marijuana. In fact, medical marijuana has been made legal as of January 2019 in 29 of the 50 states in America. You're most likely familiar with parties, political parties, and politicians and their stance on the legalization of marijuana. However, I want you to ask yourself a question. What do you know about the actual physiological events that take place when an individual consumes marijuana? If you're like most Americans, you know little to nothing about such a topic. My purpose today is to inform you about how marijuana interacts with the body so that you can make more informed decisions in the future. Marijuana comes from the plant Cannabis sativa, and the most active ingredient that causes the most side effects and that people are most familiar with is THC. According to the National Institute on Drug Abuse, cannabinoid receptors are concentrated in certain areas of the brain associated with thinking, memory, pleasure, coordination, and time perception. THC attaches to these receptors and activates them and affects a person's memory, pleasure, movements, thinking, concentration, coordination, and sensory and time perception. While the short-term effects of marijuana use are easy to study and well understood by the scientific community, the long-term effects are not so. In fact, as a whole, the scientific and medical community will readily admit that there is much that we do not know about marijuana and its impact on the body. In a recent study by Yale Medical School, they came to the following two conclusions. The first conclusion is that regular long-term marijuana use is linked to the development of psychosis in individuals, in particular, the development of schizophrenia. The second conclusion that was stated by Yale Medical School in this study is that currently the information we have on medical marijuana is too limited to determine its full effects on the body. Another study recently agreed with the conclusions that Yale came to that was published by Cambridge. They said the following, quote, "State-level marijuana liberalization policies have been evolving for the past 5 decades, and yet the overall scientific evidence of the impact of these policies is widely believed to be inconclusive." In order to better understand the topic of medical marijuana, I sat down with a family medicine physician and asked him about his feelings and thoughts about prescribing medical marijuana. While it's legal in the state that he resides in, he stated two major concerns that he has with prescribing marijuana. The first concern he stated was that marijuana has not gone through the FDA channels that other prescription drugs are required to go through. A normal prescription drug goes through a rigorous 5-step process by the FDA in order to inform doctors of a plethora of different things, including dosage information, side effects, and interactions with other medications to watch for. The doctor expressed his discomfort in prescribing the medication due to lack of information. His second concern was that the diagnoses listed for marijuana use included back spasms and nausea. The doctor talked about how these general diagnoses have known medications that work to heal and fix such issues, and that medical marijuana is so unknown he feels more comfortable prescribing drugs that have more information readily available to him. Ultimately, my hope is that you feel more informed after listening to this presentation in order to make decisions as a voter and as a potential consumer. Thank you.